I'm Kirstein Rummery. I am a professor of social policy at the University of Stirling. I'm also the Scottish policy spokesperson for the Women's Equality Party and a member of Women for Independence. So that's me and where my political standpoint is at the moment. And I want to talk to you about social justice in Scotland and whether we can look at the evidence and say reasonably that there is a uniquely Scottish vision for social justice. If we look at the arguments that sort of underpin the foundation of the Scottish Parliament in 1999, we can see that there very much was a vision from the architects of that policy, that there would be a vision of social justice that was uniquely Scottish, that would frame both what the Parliament did, how it was designed, and how it worked. And it was very important, I think, for the architects of that Parliament that the state, in this new devolved set of governance rules, played a really important role in shaping uniquely Scottish policies for uniquely Scottish problems. But if we actually look at some of those policies that have been passed since 1998, up till maybe the 2014 independence referendum, we can see that there is not that much evidence for what we might call a coherent vision of what that social justice might be. So if we look at things like the Curriculum for Excellence, which is a uniquely Scottish approach to providing education, and it was all about providing universal access to students who were going to get a broad range of both practical and academic skills, but also an understanding of their own history, their own literature, and the way in which Scotland has positioned itself in the world. And in a sense, we do see a deviation in that. There always was a different educational system in Scotland to the rest of the UK, but this is a very different curriculum than we might see, for example, in A-level history or A-level literature. On the other hand, if we look at issues like health, Scotland's always had this reputation of being the sick man of Europe. And if we look at things like poverty and income inequality, that's pretty stark in Scotland, and certainly in 1999 was starker than the rest of the UK. So it did face significant social divisions. And there was some argument that backed up the idea that the Scottish Parliament and the Scottish Government would be able to create uniquely Scottish answers to these Scottish problems. But, for example, if we look at the income inequality, now the income ratio between the top and the bottom decile was about 13.8%. by the time we reached 2014. Now, if we compare, for example, that with Norway, which is 6.1%, the Scottish Government had had quite a long time to address this inequality, and yet it hasn't, certainly not to the point at which it could be comparable to the Nordic welfare states. If we look at the gap in income low birth rate, which is another way of measuring perhaps health inequality, then we can see it has narrowed by about 31% in its peak in 2004. But in other areas, we've seen the gap increase by about 39%, for example, in long-term conditions. And in people's self-assessed health, the gap between the healthiest and the least healthy has also widened by about 47% over the same period. So in terms of tackling those big problems about inequality, poverty, health, Scotland isn't doing that well with its new powers. Now, Scotland rejected independence in 2014, and it was the task of the Smith Commission to reach a consensus on what kinds of further powers would be devolved to the Scottish Government and the Scottish Parliament. After that, the Smith Commission actually took recommendations from over 14,000 organisations, and individuals. And it worked with representation from the 5 main political parties in Scotland. The 2 pro-independence parties, the SNP and the Greens, were obviously hopeful for much further devolution of powers to the Scottish Parliament. In fact, they were quite clear that they wanted to see the full taxation and welfare powers to be devolved. And they were very clear that this was about being able to control the economic and the political levers in order to facilitate growth, but also in order to be able to tackle some of these retrenchant long-term problems like health and income inequalities. Most organisational submissions, particularly those from the third sector working on social justice issues for specific groups, obviously wanted further powers devolved so that they could tackle issues to do with their particular group that they were representing. The Scottish Government had developed, in the lead up to 2014, what we might call a much more open and cooperative style of government. So it worked very effectively with civic society, and particularly the third sector and charitable organisations, in producing and in implementing policies. And some of this is down to the way in which the Scottish Parliament was designed. So it's not a first past the post system, it's actually got an electoral system that encourages a minority or coalition government to be in power. And this means there has to be a level of consensus building and cooperative approaches to policy making to get anything done. And what we've seen, particularly in the run-up to 2014, is that the parties that were in power worked very effectively across party silos in order to achieve policy consensus on certain issues. And when they were working across party silos, there was also a great deal of encouragement to involve the third sector and to involve civic society in those approaches to policy making. However, the 3 main parties, the Liberal Democrats, the Labour Party and the Conservative Party, who were also around the table, were very much opposed to further devolution and devolution of extensive powers to the Scottish Government. And so the Smith Commission's proposal fell far short of full devolution. However, Scotland was granted the ability to look at things like the variation of income tax rates, to control disability and carers benefits, and to look at the variation in some of the components of universal credit. However, the majority of powers that would actually effectively tackle things like poverty amongst older people, which would mean you'd have to be able to control pension powers, meant that most of the main powers still remain reserved to Westminster. We do see some policy deviation and experimentation that has arisen from the post-2014 settlement. And in a sense, why have the extra powers if you're not actually going to do something with them? So there was onus on the political party, which is at the current state the SNP that's in power, to demonstrate some effective governance, but also doing something slightly different from the rest of the UK model in social policy. So we've seen things like the Scottish Welfare Fund, which has made nearly 300,000 payments totaling £164 million, which are, crucially, these are crisis grants and not loans. So they don't trap people in poverty into further poverty having to pay back the loans. We've also seen a very wide range of use of that cooperative style of governance. So, for example, user panels involved in the design of the new social welfare and benefits packages. They also took and continued to take, in fact, evidence from a wide range of experts, including academics such as myself. And one of the first things that the Scottish Government declared about the new welfare powers was that it would not be using third-party or for-profit providers or assessors for the new welfare benefits. And this is incredibly important. We have a whole range of years of evidence demonstrating that things like targets and third-party assessors involved in deciding things like personal independence payments and employment support allowance is absolutely detrimental to people who are living in poverty, who are claiming benefits, and particularly disabled people. So as an academic, it was actually very exciting that they decided to listen to the research evidence, particularly in a way that the Westminster Parliament certainly hasn't listened to research evidence on those kinds of constructions and third-party sector involvement. So we know that the process of applying for benefits is incredibly stressful. We also know the evidence of the introduction of new universal credit rules, employment support allowance, and the shift from disability living allowance to personal independence payments has caused in excess, and this is a conservative estimate from the British Medical Association, of 150,000 deaths. So it's not just an ideological question, it's a real practical question of how we support the most vulnerable people in our society. And I think there is evidence that ideologically and in the construction of the system, the Scottish system is willing to take risks, and it is willing to do things differently, and it is willing to listen to research evidence from people who use the benefit system and also from academics. That's very, very encouraging to me, both as an academic and as an activist. And it just remains to be seen how far they are willing to go and whether or not they need full independence in order to achieve all of their goals.